Well, definitely in the world filled with lots of negative news, we actually bring some very positive news. And that is our drug has been registered in Russia. That's the first antiviral drug against COVID that was registered in Russia. But what's even more important, it's the first drug based on Favipiravir in the world that is registered against coronavirus. And the history of this is that Japan developed the substance to treat flu, but so far nobody really proved in clinical trials its effectiveness against coronavirus, which we did, and therefore we got registration in Russia for this. And it's very important because we believe there are now only two drugs, antiviral drugs against the virus that are really effective. It's remdesivir, done by the US, and this Favipiravir, which also has significant promise. So we see very good results and the registration of the drug, and we will supply it to clinics in Russia on the 11th of June, is a major, major step forward.
What we've witnessed in other health jurisdictions is that a number of drugs have been needed for treatment, that there's been no real standalone drug, depending on the progress of the patient around coronavirus, just how ill they are. Is this a standalone drug that it can be used in isolation, or does it need to be used with other potential drugs and perhaps not even used at all, depending on the state of the patient?
Yeah, exactly. It's a standalone drug, and we've shown lots of improvement by half. So the median time of elimination of the virus using just this one drug versus standard therapy goes from 9 days to 4 days. 65% of patients eliminate virus completely on the 4 days, which is double the number in the standard group. And even the temperature returns back to normal 3 days for patients just taking this drug versus 6 days taking standard therapy. So it's a drug that we tested just by itself versus a standard therapy, and it shows very good results. And again, we don't want to politicize this. We made some modifications to the drug. We made some modifications to the protocol of taking the drug, and we'll share those by the end of the week. We applied for patent for those, but we believe it's something that many other countries can use. Of course, Japan took a leadership role on developing this drug, and really we applaud their efforts. And it should be an international effort to roll out drugs like this that actually promise dramatic effect on fighting coronavirus, particularly for mild cases.
Kirill, good morning. So when is the ready-to-go date? When could we expect to see the drug being distributed? And can you tell us any more about how quickly production can be scaled?
Yeah, so 11th of June is the day that the drug will be delivered to Russian hospitals. We are manufacturing 60,000 courses a month, so over obviously 700,000 courses a year. We could scale up to a couple of million. We are also willing to supply this drug outside of Russia. So it's really moving forward very quickly. And once again, we really made some very important changes that we'll share, and some of it related to also the dosage of the drug. But we believe that we are ready to go, and also we expect Japan to hopefully also register this drug in June.